Basically, I can say I'm a survivor.
At the age of 15, Immaculate Motuko noticed a lump on her neck. It will move up and down whenever she swallowed. Although it was painless, she decided to visit a health facility for diagnosis. It was confirmed that she had thyroid cancer.
To them, it looked like it's a goiter. And once they tested it, it's when they said that it was cancerous.
After 2 sessions of chemotherapy, it was discovered that the other remaining thyroid gland was also affected. The news of the spread of the disease was devastating to the young girl.
I remember there was this time that I went to do a checkup, and the doctor looked so unhappy, and I was like, am I dying? The last time I went to the hospital, I checked and I was told that it has moved from now thyroid to my esophagus and to the bladder. And that was the reason that I did the radioiodine, because they can't definitely remove the bladder. So they have to treat it before it spreads to another part of the body.
According to Dr. Catherine Nyongesa, an oncologist at the Texas Cancer Center, this type of cancer can be treated by radioactive iodine if detected early.
We discourage pregnant mothers for coming for this treatment. Women who are breastfeeding should not be given the medicine. It will be better to wait until after stopping breastfeeding or after deliveries when you can get this medication, because it can have an effect on the fetus or on the child who is breastfeeding.
However, the body gives off radiation for some time, and one may need to be in a special isolation room to protect others from the radiation. This kind of treatment is traumatizing for some patients, and as Immaculate explains, being alone in an isolation ward without interaction with family and friends took a toll on her mental health.
Throughout my journey, that was the worst part of my life, because now in isolation, you don't carry anything. There are no phones. You use the extension that is provided by the hospital, and anything you go with it inside that room, you don't come out with it. Even the clothes that you're wearing, they're burnt. Okay, to me, I felt like I was alone in a desert and I have no friends. And even the doctors coming in dressed like those PPEs, they were so scary. And I would just cry myself out. The only thing that I had there was a Bible.
Once the body receives iodine, it starts to emit radiation which could be harmful to anyone who comes into contact with the patient. Some of the effects may include:
if you're exposed to that person when they are in the beginning, when the radiation in their body is high, then you may have that radiation, you may absorb it, and then many years down the line you can get cancer, for example. Sometimes fertility issues.
According to research, the radioactive iodine may also affect a woman's ovaries. Female patients with thyroid cancer are advised not to get pregnant for 6 months after the treatment, but for Immaculate, the story was different.
Actually, I had a very smooth pregnancy. Though the entire time that I was pregnant, I was not supposed to take any radioiodine. I was not supposed to take any chemo. I just took I just took levothyroxine, and the entire journey was successful. Though she was born asthmatic, but by the age of 1 to 5, she's okay right now.
The treatment often kills an excessive amount of thyroid cells, leaving the thyroid unable to produce enough hormones, which forces patients to be on medication for the rest of their life.
As a government, knowing that cancer is extremely expensive, I think they should be given out for free. Times you find that those drugs are very hard to get. I remember there was a time I would post them in Facebook, and I would ask friends, if you're working in this pharmacist, kindly, can I get this medicine, because I can't do without it. Taking those medicine every day, it's not easy. And at times you don't have them, and you have to look for them.
The 31-year-old, whose workplace has now given her the liberty to work from home due to her condition, can only hope that she lives to tell a story of hope and victory.
And every time I walk to an hospital, I'm here thinking like, would I get something that will scare me, you know, that feeling. I still have it even now. As I talk, I normally get frightened. It doesn't matter where your cancer is, but just keep going. Don't give up.
According to the World Health Organization, 9 out of 10 thyroid disorders occur in women, and there's need now to raise awareness on the thyroid concept that is still foreign in our country. Gigi Namagundu, K24, Nairobi.